Let's get you more reaction and unpack some of the announcements made by President Cyril Ramaphosa. And I'm joined now by the Health Department's Director General, Dr. Sandile Buthelezi. Good evening, and thank you for joining us, Doc. So, just as a starting point, are you satisfied as the Health Department as well as broader government that the regulation amendments made ahead of the lifting of the state of disaster eventually, that they represent sound scientific advice and, taking into cognizance some of the views expressed during the last few days and weeks of consultations?
Thank you very much, Makuja. I'm not sure if I am actually quite audible. And good evening to you, and good evening to the viewers of eNCA. Yes, I think the few issues that we need to take into consideration, what the President expressed today was what we presented as the National Health Department to the NCC, to the PCC and Cabinet. I think there's quite a number of issues. We do have a number of advisories that we get from our scientists. However, we do need to consult broader beyond the scientists. When we get the MEC advisories, we do have some consultations, the President has mentioned, with the religious leaders, with the other sectors, tourism sectors, and then we come with a consolidated view that we bring forward. But we think what we are bringing in forward now is a progressive movement towards the full opening of the country, and this will be a staggered view based on where the country is at what particular moment, Makuja.
All right, Dr. Buthelezi, there seems to be a bit of a challenge, but we are hearing most of what you are saying. And if for some reason we lose you, I will definitely prompt you and ask you to repeat because we don't want to lose any of the points that you are making. Now, someone will be asking, why not just lift the national state of disaster outright? Why kick to touch in as far as that is concerned?
Thanks, Makuja. Firstly, we must understand why did we first ask government as health to institute the state of disaster? It's because the legislative instruments at that time were not good enough for us to deal with the epidemic like the one that we had. So we asked for this whilst we try to review our legislation. But for us now, we think it might be irresponsible for government that is carrying to lift everything up. We rather go a progressive way towards lifting everything, watching what is happening. The scientists, as you will listen, all of them won't tell you what's going to happen in the next few months. So it's all calculated guesses as we move forward in terms of what might happen in the next few months. So we're saying this is a start. If we are improving vaccination and we watch the situation, we might be releasing more regular restrictions as we move forward as a country.
Do you as government accept the view that says that in terms of that curve of how far we are with the COVID-19 situation, immunity has improved significantly from previous infection, some people more than once during the last 2 years in terms of them being infected, and that accounts for why we are seeing the kind of the burden on the health system being lesser during the Omicron variant, and therefore we should be making decisions partly based on that, but also partly based on we're not where we want to be in as far as vaccination is concerned, but we're not where we used to be in that a significant portion of our population is vaccinated. Do you take that into cognizance?
Yes, Makuja, we do. We do take that into cognizance. However, we must understand that to run a country, you need to take a number of variables into consideration when you make decisions. You will note that we've got a lot of countries, some very well vaccinated, but we're seeing quite a lot of increased cases now as we're moving forward. We are saying as a country, we need to be risk averse and just monitor the situation and slowly remove the restrictions as we move forward. We do listen to our scientists, and we really appreciate their input as we move forward. However, we need to ensure that we bring everyone on board. We consider all the sectors, all the variables, and we slowly move towards removal of everything, whilst ensuring that we do not act recklessly, as our president has mentioned previously and also in Parliament last week.
So, Dr. Buthelezi, if you were to sum up what the purpose of the current regulations as they stand, if we park for a moment the regulations that are being consulted over, if you were to sum up in one or two sentences, what is the purpose of these current regulations? It used to be that we wanted to, quote unquote, flatten the curve and also to curb the spread of the virus. Many are saying that that horse has long bolted. The virus is spreading in our communities and has moved to a state of endemicity, in that it's endemic in our populations. So if you were to use your own words and crystallize as government, what is the purpose of the current, the main purpose that you are seeking to achieve?
Yes, the simple one, Makujwa, is that one, we don't want to be caught off guard in the future. Wait until you get a very severe hemorrhagic fever outbreak. You get an Ebola, you get dengue fever, or you get any hemorrhagic fever. We want to be ready because we don't want to go back to the state of disaster as a country. So that's what we're trying to do. We are being risk averse. We're introducing these regulations, but more importantly, we are saying these are up for public comments. So scientists who want to comment and raise objections or whatever, they have an opportunity until the 15th of next month to say those. And we've put together a very capable team to review those and see if we can incorporate them. That's the reason why we say they are for public comments. But for now, these are not only for COVID. However, COVID has taught us lessons that we want to take forward for any other epidemic in the future, so we don't have to go to the last line of defense, which is a state of disaster.
Sure, I hear you, Dr. Buthelezi, but I think you are already moving to the proposed regulations, which I will turn to in just a moment, because I do want us to have that conversation. But I'm asking the tweaks that have been announced this evening by President Cyril Ramaphosa. If someone were to ask you, what purpose are you seeking to achieve? Is it to stop the virus from spreading, which was the initial approach that said, contain it and make sure that it doesn't spread in our communities? Is it to ensure that the curve is flattened such that you have time to build up capacity in our health facilities, which also used to be a target? Is it to ensure that people don't fall sick, severely sick, which we've seen that, in terms of the trends, that does seem to have moved somewhat? What are you seeking to achieve with the current tweaks to the current regulations before we turn to the other, the ones that are in terms of the National Health Act?
Yes, no. What we're trying to achieve, Makujwa, is one, we want to contain the current epidemic. We're not where we want to be currently. So we want to contain it and ensure that we are able to manage it and respond immediately if we get an increase in cases. That's what we're trying to achieve for now. In terms of the health system's readiness, I can tell you now, we think as a Department of Health, we've managed that. We're at the right level, and we are able to deal with increased cases in terms of the health system's readiness. However, we are saying we are now also wanting to make our health system to be ready for any increased cases, whether it's from COVID, whether it's from any notified medical condition. We should be able to be dealing with that as moving forward. That's what we want to achieve. But we want to also tell the public that we are not over the epidemic. The epidemic is here, and we might be getting the next wave, so we shouldn't really be found wanting.
Right.
We must be ready to deal with that wave with some restrictions.
So lastly then, before I run out of time, let's turn to that big talking point, Dr. Buthelezi. The regulations that you've proposed and have put a deadline of the 15th of April for South Africans to comment those regulations have set tongues wagging, really, in that, and I'll be upfront and frank with you, and I'm not afraid to say this. My reading of it is that this is locked down by another name if they were to pass the way that they are. Restrictions such as, at funerals, up to 100 people and no more. Issues such as contact tracing, something that many scientists say serves no purpose in this day and age, in an age where, the virus is already spreading. Quarantine requirements, including ensuring that, including compelling people, making it mandatory for people to undergo quarantine, etc., etc. I can go on and on. My own sense, and I believe it's the sense of a number of other people, is that this is locked down by another name. Just tell me what the rationale is for these proposed regulations.
Thank you, Makujo. You're talking of what scientists have been saying around COVID. Tomorrow, if you get a hemorrhagic fever like dengue fever, remember these regulations are not meant for COVID. They are meant for any epidemic beyond COVID. Quarantine might not be required now for COVID, but you get Ebola tomorrow, you get any other hemorrhagic fever or any notified medical condition. So we're trying to be ready for any emergency. So please don't box these regulations and box them to COVID. So we are saying we're putting these regulations to be ready for any emergency in the future to deal with notified medical condition. However, I must actually say that these are for public comment. So anyone who is worried about the way they are drafted, they have an opportunity to comment. Be it a scientist, be it a religious leader, be it a traditional leader, be it a committee person, they must comment, and we'll take that into consideration before we finalize them. Thank you.
I see. So the rationale is that they're not just about COVID-19, and I think that's fair enough for you to argue that. Lastly, I've seen a lot of chatter this evening around the issue of funerals. And one way that someone has put it is, whatever did funerals ever do to you as government, that no matter how much we tweak regulations, funerals remain quite restricted. And this is an important area of people's lives and their sense of dignity. It's a roundabout way of me asking you, Dr. Buthelezi, if I can go to FNB Stadium, which has a capacity of 90,000, under these new regulations, 45,000 of us can now go to FNB Stadium. Why can't I go to a funeral that has, 300, 400 people that want to bid farewell to someone who has passed on? Much of it will be happening outdoors.
Yeah. No, thanks, Makujo. That's why these are for public comments. If Thulasizwe Simelane has got a strong point to argue around funerals, we welcome that and we'll deal with that. However, what we've seen is that funerals have been a serious problem in terms of spreading the virus. However, we're open to discussions. You have to put a point for someone to be able to actually raise their concerns around it. And we're saying we're open as government. We've raised this with the churches. We've raised this with traditional leaders. And this is an opportunity for people to argue and say, why are funerals different from weddings? So, and as a listening and a government that cares, and we're considering everything that we can consider that will come forward to deal with those issues. So we're saying this is open for comment, and we'll deal with it as government and say, probably we might be wrong. However, science has told us that we've seen funerals being major spreaders of the virus.
All right, Dr. Buthelezi, unfortunately the audio kept fluctuating from time to time, but I'm glad we had the conversation. We were able to hear much of what you were saying, and in particular the clarity that the proposed regulations, as he says, the Director General there, are not only about COVID-19, but any other notifiable disease situation or epidemic or pandemic that we might have to deal with in the future. I leave it to you what you make of all of that. That was Dr. Sandile Buthelezi, who is Director General at the Department of Health.